you guys. I'm Clara and I have stage 4 lung cancer, and welcome to Cancer Questions with Clara, where I answer one question a day about my experience as a cancer patient. Today's question is, what is or was your cancer treatment? So today we're diving into my third most asked question. If you want to see the other two, which are what were my symptoms of cancer, and then kind of what was the story or how did I go about getting the cancer diagnosis itself, those are on my profile now. If you want to go take a look, please do that. This is also another long video, and if you watched the entire story of how I was diagnosed with cancer, thank you. That one was a journey. So thank you for tuning in for that blockbuster. Okay, anyway, I did want to preface by saying that this will probably be the last time I share kind of this part of my journey for or at least like the beginning of it for a while, because each time I share my story of my treatment in 2025, it does kind of take a little piece of me with it, and I want to save the rest of those pieces for when I am able to advocate for cancer and share my story to lawmakers or scientists and other decision makers for cancer research and funding. And so I hope you guys understand that I will definitely answer questions in the comments or make videos to reply to questions, but this will probably be the last long-winded explanation of my treatment from last year. Okay, so buckle in, grab your popcorn, and get ready. Okay, so I think we left off with I was diagnosed with obviously stage 4 non-small cell lung cancer, and the way they determined that was through doing biopsies. So they did a breast biopsy at St. Francis Hospital in Colorado Springs, Colorado, and then we had some issues, I guess, with that biopsy or not receiving it. I'm not really sure exactly what happened, but I did have to do a second biopsy, which was a liver biopsy in Des Moines, Iowa. And that's how they send that off to various testing, but one of them was what's called a Tempus testing. And Tempus testing, I've talked about this before, it's a genetic test, and it helps determine a personalized sort of cancer treatment plan for each individual. It's unique to each person, and it also identifies different biomarkers, which are just DNA mutations in somebody's sample that can help also drive whatever treatment is done for that patient. At the time, my Tempus test actually came back with MSH6, which had no targeted therapies available to it. So Tempus testing also helped direct, like I said, my oncology team to what chemo would be right for me. And so I got started on a plan of chemo, and I can actually tell you what it was. So it was carboplatin and ipilimumab. I'll have to just type it on the screen here. Anyway, I started out with those two types of chemo and immunotherapy for what was going to be my first 6 rounds of chemo. However, I forgot to mention, I actually started, I ended up going into the hospital and was inpatient, where I started brain radiation because they discovered I had mets to my brain. And it was noted on a scan in February of 2025 that I had about 30 to 35 tumors in my brain. So we got on that right away. And then starting also in February was my first round of chemo, like I said. And I did the 2 rounds of chemo plus immunotherapy once every 3 weeks for 6 rounds. Each round of chemo came with its own different challenges and side effects, and blood transfusions, platelet transfusions, getting fluids all the time. My body was starting to take a toll. And then after my 5th round of chemo, I unfortunately started to feel very sick, like flu-like symptoms. And I went to bed one night, and my mom was checking on me, and it came to a point where she couldn't get me to wake up when she went to check on me. I was unresponsive, and she ended up calling 911, and I was rushed to the emergency room by an ambulance, obviously. And I ended up in the hospital for 10 days. And the first 3 days were spent in the ICU with sepsis. And the first 3 days when I was in the ICU, I completely blacked out. I don't remember any of it. And it was a very, very scary time. And all my levels were dangerously low. And my parents thought like I was literally going to die. And I can kind of share more about that story maybe some other time, like I said, when I've kind of processed some things, because I'm starting to realize I have a lot of medical trauma that I do still need to address and process on my own time. So once I bounced back from that, we did kind of push chemo round 6 off because I was in the hospital and then needed time to recover. But I was finally able to do my chemo round 6 and, finish chemo with a little certificate at my cancer center on July 3rd, 2025. However, the next day I went into the hospital, same thing happened. I thankfully didn't go into sepsis as far as I did the time before because we caught it early, but it was another 10-day hospital stay. And that was, at the time, that was my, already my 4th hospital visit of the year. And so, it was, like I said, it's a lot on my body, and it was really, really exhausting. But anyway, started feeling more like myself after that, and I was like, woo, thank God chemo's done. And then in August, I had some scans, and they were great. And by the way, this whole time I was still doing immunotherapy because I was supposed to just be on maintenance immunotherapy for the rest of my life. So that was every 3 weeks. I still went in for an infusion. It just was a much shorter appointment, basically. Like I said, I had great scans in August, and just continued on in the fall, getting more social and active and feeling more like myself, continuing Keytruda. And then it came time for my next scans. So 3 months later, it's a lot of cancer scan cycles run on 3 months. So after August, my next scans were in November. And I just expected everything to be fine and dandy. And not to say things were perfect in August, but I'm stage 4. So the goal is to keep things stable and or shrinking, which that's what we got. We got some results of some stable, some shrinking, maybe a little tiny growth, and certain spots. And then in November, my scans were, everything was worsening. It literally said worsening metastatic disease. And it had also spread to my spleen in November. Prior to the November scans, because I was doing so well, I was eligible for surgery. So we had scheduled surgery for my pelvic tumors for December 1st. However, with how bad my November scans were, surgery was pushed indefinitely. It still has not been rescheduled. And that's been really, really hard for me. And that's something I'll talk about later. But anyway, so what we decided to do was, okay, this cancer is aggressive and we need to treat it aggressively. So we're going to start another aggressive chemo regimen, and we're gonna do a different chemo, and just one this time, not 2. And we're gonna keep immunotherapy, but we're gonna just order the Tempest testing again, the DNA testing that I talked about earlier. So while that testing is being sent off, it's kind of forgotten about in my head, and you know those things take forever to come back. So in the meantime, I started chemo round 7. Same thing happened again. Went into the hospital for 10 days with infections and fevers and just like whatever could go wrong went wrong. And I decided I can't do this anymore. This is too hard on my body. Like, and I feel like I was speaking like a different language to people, because it's like, no, you don't understand how sick I am and how hard this is on me. And I decided, you know what? I'm not doing this anymore. I'm not doing chemo. I'm done with treatment, because I'm doing this for the wrong reasons. I was doing it for everybody around me and not for myself. And that was a really hard like decision to come to. And my parents were like, well, you know what this means. Like, it's out of our hands. It's out of your hands. And it's like, it always has been. And I don't want to continue to poison my body and spend my days in a hospital bed. So but like I said, this Tempest testing was kind of out there in the universe, and finally made its way back to us. And thankfully it showed that I am actually ALK positive, and ALK positive has a targeted therapy available. And so that was amazing news. And so even though I had already made up my mind and decided, I was going into this oncology appointment with my oncologist, obviously, and I in my head was going to tell him I'm done with treatment. Like, we're done. We're stopping chemo. And he had actually like beat me to it and said, well, we have this amazing drug for you to try. And so targeted therapy is just an oral pill I take every day, and it's in replacement of chemo. It's not related to chemo in any way, shape, or form. And I've been on targeted therapy since December, and it's been great. I've had minimal side effects, and we'll see if it's working. In my next scans are next week, so this month in February of 2026. And I'm excited to see the results, but I do know that targeted therapy it takes longer to show results. But there's a lot of promising data out there, and a lot of people are having more extended prognosis, so much longer lives lived. And so I'm really looking forward to that, and what a blessing that has been for me, definitely. So if you've made it this far, thank you so much for listening. If you have any questions, I don't know if I covered everything. If you have any questions, please comment them. I love reading the comments. I'm really sorry I don't get to everybody, but know that I see them, and I love you guys so much. Goodbye. Sorry, one thing I forgot to add was back in November, those scans really highlighted the bone cancer in my lower back / right side hip area, and I was experiencing excruciating pain in that area, and had been from 2024. If you go back to my symptoms video or diagnosis story video, you'll know that I thought I had this running injury there. It was a whole thing. Anyway, I ended up being able to do radiation down there. I did 5 rounds of radiation while I was in the hospital in November. So I did that inpatient, and hopefully these scans here next week will show things being stable and or shrinking, and these scans will determine if I'm still eligible for surgery or not. So please send good vibes my way. Gosh, sorry, one last thing so I don't have to type it on the screen. If you weren't kind of counting along, that brings the grand totals of last year's treatment to 7 rounds of chemo, 10 rounds of radiation, dozens of blood and platelet transfusions, I think 20 to 30 rounds of immunotherapy, a grand total of about 40 days in the hospital, and one diagnosis of non-small cell blood, stage 4 non-small cell lung cancer with mets to my breast, my liver, my lymph nodes, my pelvis, my spleen, my brain, and my bones. Wait, I don't know if I repeated some of those. Whatever.